We've had people come in and say, what actually is a crown? And that's a great question. Your natural tooth we call a clinical crown. That's something when you look inside of there and you see your molar, your front tooth, we replace those with a crown. And the nice thing about a crown is that if a tooth is broken down, let's say you lose part of that tooth or you've had large fillings put out, you're able to place on top of that a crown, which encompasses the entire tooth under that crown, and you're able to chew with that. Sometimes that part of the crown will break, just like a tree stump in the ground will break, and no longer can you restore that. So what you end up having to do is you'll put an implant down into the bone, and on top of that implant, you'll place a crown on top of that. And that is what we do, and that's why we make that, and we'll put the crown on top of that individual implant. And a good example of that is you come in, you might have broken your tooth off, and we'll place immediately that day a mini implant, and we'll put an artificial temporary crown. After that tissue's healed within several months, we'll put a permanent crown and you'll be as good as new. The biggest reason we like to put a crown over a tooth because the tooth has been broken down in numerous places, and it's important that we put a full cast crown over your tooth in order to maintain that structure and give it support and strength. That's really important, so you can chew the nuts that you like and other hard foods. Without that, the tooth would completely break down and you would lose the tooth.